Can we just talk about plastic surgery?
I've had a facelift.
I honestly think I missed out on the facelift.
I've had it done so often, next time I'll have to start shaving behind the ears.
There's not one part of my body I haven't had twisted, lifted, elongated.
I'll make you 20 years younger.
I had bad plastic surgery. Should have known this doctor was a quack.
Hi everyone, I'm Dr. Amir Karam, board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today I'm really excited to talk to you about a topic that is obviously very near and dear to my heart, and that is facelift surgery. As you all know, I specialize in facial rejuvenation, and at the center of all that is facelifts. And it is a topic that I think has a ton of confusion, a ton of misunderstanding, and quite frankly, many of you who are out there wondering, what type of lift you should get, what's the downtime associated with, what problems does a facelift address, you name it, we're gonna address it in this video, and that is why it's called the Beginner's Guide to a Facelift. By the end of it, you're not gonna be a beginner, you're going to be an expert. You're gonna know more than 99% of the people out there when it comes to the topic of facelifts. All right, so without further ado, let's break it down. So what is a facelift? The name sort of speaks to what it is, but it's a little confusing because a lot of times people associate different things with it. They talk about liquid facelifts, they talk about non-surgical facelifts. There's a variety of different types of facelifts, which we'll get into in a second. But here's the basic deal. When you hear the term facelift, you are talking about a surgical procedure performed by a board-certified facial plastic surgeon or a board-certified plastic surgeon. Those are the two medical and surgical specialties that are technically allowed to do these procedures as far as board certification goes. So that's one of the important points, and that ultimately it is a surgical procedure. Anything that falls under the realm of non-surgical is not actually a facelift. And as we go through this discussion, you will understand why that distinction is so critically important to make, because you as a consumer don't want to fall for something just because it has the term facelift associated with it and think that you're getting an apples and apples situation. It's not. Surgical approach to lifting the face, putting the face technically back into the position it was when you were younger. So let me just back up for a second. The concept is you want to ultimately look natural. You ultimately want to look like yourself. You just are tired of seeing the aging changes take place. So the facelift procedure is what is going to bring the face back to its original position. Keep that in mind. Surgical procedure, original position, and if done well, very natural. Now we're going to go through the topics and discussion about how that can be achieved in a very reliable way and answer any questions that you may have related to the facelift procedure. So what are the different type of surgical facelifts? Well, you probably have heard terms being thrown around like mini facelift, full facelift, SMAS facelift, deep plane facelift, etc., etc. So here's the bottom line. There's really no direct distinction between these different procedures. So for example, when somebody calls it a full facelift, there's no definition to what a full facelift is, right? When somebody talks about a mini lift, they could be just referring to it, as a mini lift, even though it's technically a full facelift, or vice versa. The bottom line is, as a consumer, you need to understand what's actually happening and forget the term that is used, because again, surgeons use these terms sometimes interchangeably, friends and patients and people use them and you don't really know what's going on. By definition, what a facelift does across all the different, terms, and I'm gonna say just one caveat to this is, as long as it's not a skin-only type of a facelift, which basically doesn't even really count as a facelift. So what it is basically there's a layer under the skin called the fascia. The fascia is what holds the face up during youth, almost like a girdle. It holds everything up. And with age, the fascia starts to elongate and loosen. And when it loosens, the facelift operation is designed to tighten the fascia and bring the fascia back up into position. If you're early in the process and you want to make the thing sound a little bit lighter and call it a mini facelift, you're a little bit older and you want to call it a full facelift, none of that really matters. As long as the SMAS, which is the term that's used to define the facial fascia, as long as that is being directly lifted back up into its position, it is by definition a facelift. And regardless of the terms that are being used, you know what you're getting. What you want to be careful of is, for example, if you are under the impression, for example, you're getting a more advanced type of a facelift procedure. Like the most advanced approaches to facelifts nowadays are the deep plane facelifts. At least that's the current state of the art. It's the most advanced, longest lasting, generally speaking, best looking outcomes, etc. So if you are under the impression that you are hoping to get one of these type of lifts, but instead you go for a more traditional SMAS type of lift or plication type of a lift, etc. These are terms that are used. If you're trying to get a deep plane, but inadvertently end up getting one of those, you're going to be disappointed. So knowing these distinctions are very, very key in defining the type of lift you're going to get if you know the terms and what they apply to. So let me just give you a few basic terms. Different ways you can approach the SMAS. So the SMAS is that fascia. The plication facelift means that you lift up the skin and you literally just sew the loose SMAS onto itself, kind of bunching it back up, right? You're shortening it by bunching it. That's a plication type of a technique. Then there's technique like the deep plane approach, where an incision is made through the SMAS and a dissection is taken down to various ligaments and underneath the fascia to loosen everything up and bring everything back up into position. That's what gives the deep plane its robust change as well as the most durable result you can possibly have. Additionally, there's another traditional type of lift called the SMAS facelift. You probably all have heard of that. And the SMAS facelift is an incision that's made closer to the ear and the face is pulled sideways. So the bottom line is this: the technique is important if you're looking for, levels of improvement, but also the vector of the facelift is extremely important. And I'll touch on this a little bit more in detail later on, but the vector is important because if you pull the face sideways, you're gonna get an unnatural look, right? So certain type of facelifts, like the traditional SMAS facelifts and certain types of imbrication facelifts that are pulling the face sideways, you're gonna end up looking a little different. You're gonna look a little bit pulled, you're gonna look a little off, and you're gonna look like you've had a facelift. And not to throw another loop into this picture, but one of the things that was so important for me and my patients was that they have a very natural looking outcome. And I've actually taken the deep plane facelift, added a few bells and whistles to it, increased the verticality of the lift to make it go more or less up. So when you're going to the mirror and you're kind of doing this, that's the result you end up getting. And I call that a vertical restore. All right, so the distinction is important because if you think you're getting a vertical restore by going and getting a SMAS facelift or getting a standard deep plane, you're not getting the procedure. So these distinctions are important in terms of knowing what you're getting. And at the end of the day, it can be confusing. So as we discuss this and develop this conversation a little bit, you'll be more knowledgeable about what to expect. In today's state of the art, the kind of standard best type of lifts are based off of a deep plane, and the vertical restore, which I perform and I developed and trademarked, is a deep plane facelift with other bells and whistles, just to kind of put that all into context for you. So a super common question is, when do you know when you're ready for a facelift? This is a great question. So the time you know when you're ready for a facelift is when you do the following. You find yourself in the mirror and you're doing this, right? You're going up like that and you're like, man, do I look like I used to? I really feel like my face has gone back to its usual, because what happens is with age, everything starts to come down. And what occurs is you start looking at yourself in photos and videos and in the mirror, and you're like, wait, I don't even recognize that person anymore. You start to look different, and there's a good reason for that, because as everything starts to come down, the facial shape changes. And when facial shape changes, your look changes. You look like a different person. So by bringing everything back up into position, and people do this all the time, they're in there kind of doing this all the time. When you start to find yourself doing that and liking the effect and seeing yourself come back, anatomically, you're ready for a facelift. So anatomically, On the other hand, you have to be emotionally ready for it. In other words, you have to feel emotionally ready to, go through the downtime, the process, the expense, there's some risk involved. All of that stuff together has to be worth it and worthwhile for you to go through. And that's where the emotional aspect. So oftentimes people might be, in a perfect world, I take do something quick and my face goes back, I'd be fine. But I really don't want to go through all of it. Well, you're not ready for it. But once you're ready for it, you will climb the highest mountain, you'll go through the biggest hoops to get your facelift done, because you don't really want to live this way for much longer, because you really don't find it to be looking as young as you feel. Really, that's what it comes down to. If you don't feel like you look as young as you feel, that can be disheartening and kind of be bothersome. So at the end of the day, anatomic indication is when you do this and it looks, a lot younger and better. Emotionally, you can answer that question. So those two things have to come together in order for you to be technically a good candidate for a facelift. I never look at somebody and just say, oh yeah, you have jowls and you have neck laxity, etc. You're a candidate for a facelift. No, the person's emotional state towards those changes is equally as important. So anatomically, the presence of jowls and looseness of the neck are the two major obvious things that people look at. Jowls is defined by, this fascia, the cheek fascia comes and hangs below the jawline. And when it does that, you end up getting like this little lump down here. And then of course the neck sags. Those are the things that let you know that, anatomically you're ready to go. Now, what's actually happening is the laxity starts from the corner of the brow comes down, the mid-face comes down. All of this starts to come down together. And again, that's part of the reason why I perform the vertical restore, is because I want to bring all of that back up into position. Because a standard facelift, either whether it's a deep plane or anything else, basically just addresses the jawline. But people are bothered by the neck, the jawline, the midface, and the lateral brow all together. Just a side note. So on that note, what are the common signs of facial aging that a facelift can improve? And what can't it improve? So the standard facelift, whatever you want, what style you're, is designed to improve the jawline. It's a jawline procedure. So jowling, sagging, jawline goes up. Now, you can add a neck lift to it, you can add a brow lift to it, but the focus or the target of the facelift is the jawline. The jowls is what you're going after, right? What it doesn't improve, it really doesn't get rid of a nasolabial fold. Not that you should even try to get rid of a nasolabial fold. It's a normal part of a human face, but it doesn't really get rid of a nasolabial fold. So if you're worried about nasolabial folds, you're not going to get rid of them with a facelift. It doesn't do anything to your eyes. So if you need eyelid surgery, then you need eyelid surgery. So if you need upper eyelid surgery, that's an upper eyelid blepharoplasty. If you need lower eyelid surgery, that's a lower eyelid blepharoplasty. It doesn't do anything to the volume. So if you need volume, you do a fat transfer, or maybe you put some fillers into the face. It doesn't do anything to the skin. So if your skin is starting to see signs of aging, that's when you need skin care. That's when you need possibly chemical peel or lasers. You're not going to get improvement in your skin or crepiness or thinning of the skin improved by a facelift. A facelift by definition is a jawline procedure. Again, the vertical restore is a lateral brow lift, mid-facelift, jawline lift, and a neck lift all together just to make the story easier and the result more harmonious and natural looking. But normally you'd have to add those other components to the surgical plan in order to get them addressed. The facelift procedure is a jawline procedure. So who is a candidate for a facelift? Does not matter how old you are. This might sound shocking to you, but I practice this. I see this all the time. There are 30-something-year-olds who have jowls and neck laxity that are more advanced than a 50-something-year-old, sometimes even a 60-year-old. It's a genetic thing. Some people age a little bit sooner, some people can hang on a little bit longer. The average age for people to start seeing the signs of aging to where they would benefit from it, by far our most common age for people to get this procedure done is in the late 40s, early 50s. That's when most people find that the changes are occurring. And for women, it tends to fall right around perimenopause and menopause. And when that process happens, the laxity starts to occur and the aging changes happen. So the best candidate is somebody who has those anatomic changes, who's emotionally ready, has good expectations. In other words, they're not expecting to look 20 again. They just want to look more like themselves. They want to look natural. They want to get the jowls and jawline improved and, move on and be very, very happy. So somebody who is not expecting perfection is a good candidate. That's an important distinction to make. Trust me when I say this, you will drive yourself and your surgeon absolutely crazy if you start looking at your face like it should be some type of perfect canvas. It is never going to be. You'll always have a little bit of laxity. You'll always have some, lines and wrinkles. You'll always look, to some degree, have some aging changes going on. It's never going to look mannequin tight. And by the way, the changes, continue, the aging changes will happen, but they'll just happen significantly slower after a well-done facelift. And this is really an important point to distinguish here, that it's not that the changes are permanent, and it's not that they unravel all of a sudden, and next thing you know, you're like however old. But let's say you're 50 and you have a lift done. It's a well-done lift, and you never get another lift for the rest of your life. Now you're like your late 70s, 80s. You're gonna look like a significantly younger 70, 80-year-old than had you not had the lift done. I always tell people, if you had an identical twin who didn't get it done and you had it done, for the rest of your lives, you will look a lot younger once you have it done. Now, how long do these things last? They last about 10 or 15 years when they're well done. They last like 6 months to a year if you end up getting a poorly executed, generally speaking, not well done facelift. I mean, you'll be right back wanting to get another one very soon. In fact, we have so many patients that have had a lift within a year or two. I don't want to discourage you. I'm just pointing out an important point. You got to do your homework. They have a lift and they're like, nothing even looks different. I look exactly like I did before. It's a year or two later, and then of course, they come back and they want somebody else, or go back to the surgeon. They need to redo and all that kind of stuff. We do a lot of revision surgeries for patients in those situations because they didn't get the right lift done the first time. The proper candidate is somebody with good expectations and the right anatomic changes. And as far as how long it lasts, it is going to last you 10 or 15 years, not look like it was brand new, but it looks like that's a reasonable period of time that you go in and get it like a refresh if you feel like you're ready to have another one. And if you're not, then you just continue on looking significantly better for your age for the rest of your life. Like, there's no mandatory you have to get it done. It's not like, breast implants where they say you have to remove them and replace them at a certain period of time. This is not like that. How you feel will determine when the next time you need to do it. So what kind of results can you expect? Now, that is totally 100% dependent on the surgeon you choose. Believe me when I say this, we have people, I'm not exaggerating, literally from all over the world who come to have surgery with me. They come for one very specific reason, because when I do these procedures, my vertical restore, people look 100% natural. They don't look like they've had any work done. They look like themselves. They look a lot younger. That's what my patients come to expect, because they've seen literally hundreds of my before and afters and on Instagram, etc. So you know exactly what to expect. So what you should expect is what the surgeon is capable of producing. So again, look at the before and afters, look at the quality of the work. That will give you an idea of what to expect. Now, if you want to talk about the highest standard of outcome, what you should expect, if you want sort of the best that can be done, well, as I described it, I mean, what can be better? If you look like yourself, so you don't change your appearance, you don't look like you've had any surgery done, you don't have any stigma of surgery, you don't look pulled or tight or different or windswept, etc. You retain your identity, and you don't walk around with a sign that says I've had a facelift. And obviously you look years and years younger. You can't say how much younger you're going to look, because that also depends on how aged you are to begin with. If you're really aged, you're going to look a lot younger after a well-done lift. If you're just in the early stages of aging, like a lot of our patients, they want to kind of like nip it in the bud. They don't ever want to look old. So as a result, at the first year or two signs of aging, they go in and have the vertical restore. Well, guess what? If they're in their late 40s, early 50s, they're going to look like they're in their early 40s and late 30s by the time we're done, because it doesn't take much to get them back to that level. If on the other hand, you wait till you're like in your 60s and 70s, well, you're not going to look 30 at the end of the procedure. Is just impossible to get that type of change, because the whole face is remodeled, right? So the whole face has changed at that point, which brings us to another really important point. Is it better to do it early or later in the process? So honestly, my feeling is The earlier in the process you do it, the more reliable, more natural, more subtle, less noticeable the changes are. But really beautifully about that is that you don't have to experience the full aging effect. You get to basically preserve your youthful look without watching aging kind of take a lot of that away and then try to regain it later on. But again, at the end of the day, you have to be ready. You have to have found the right surgeon. You have to, all your ducks in a row, etc. So it's not like you can just make that decision and just go for it. But if you have the opportunity and you're emotionally ready for it, then I would say the sooner you do it, the happier you will be with the outcome and with the fact that you're not paying attention to your face constantly and watching yourself age and being dissatisfied and not wanting to take photos and all that other stuff that goes along with it, the emotional stuff. All right, so let's talk a little bit about what recovery is like. Now, I put out a lot of videos on my surgical patients' recoveries, and I can't speak to how other surgeons' techniques and the approaches and all that stuff, how that manifests into downtime. But I can tell you, at least with our practice, recovery is very predictable. It's usually about 2 weeks. What that means is for the first week, you look like Avatar, you look like crazy, swollen, weird, all that stuff. But it's amazing how quickly you go from week 1 to week 2, boom, so much swelling is gone, you look significantly better and you're ready to go back to work and all that kind of stuff. You're not like ready to be on the evening news or whatever the situation is. You're not there at 2 weeks, but you're not scaring little children at a grocery store either. Like it's that kind of a situation. Now take another practice, maybe extend that by another week or another 2 weeks. You just have to have that conversation with your surgeon that you choose, because everyone's got a little bit of a different path to recovery. But for us, it's typically about 2 weeks. And I would say, generally speaking, you should expect about 2 to 4 weeks if you want to kind of generalize about the topic. And remember, the first week, forget about getting out and about. You're gonna be nowhere near restaurant ready at that point. You're not gonna be wanting to be, no one's gonna wanna see you at that stage. So don't make plans. Stay at home, watch TV, read, relax, that kind of stuff. This is probably also variable again, but with our patients, and I hate to I don't want to generalize or make any kind of like set expectations the wrong way, but generally with our patients, we do this under local with IV sedation. We don't put patients under general anesthesia. The time that most surgeons take to perform, I perform them in about half the time. So, and why that is because I've been doing it for 20 years. I do it day in and day out. I don't do any other type of plastic surgery. This is all I do. And I know my way around the face, and it's very predictable. And the benefit of that is that there's less tissue exposure, there's less swelling, there's also less postoperative pain. Most of our patients are not taking pain medicine, they're not taking, all these other things. And because you're not doing general anesthesia, cognitively, mentally, you're with it very quickly. If you have general anesthesia, sometimes there's like 2 or 3 days of fogginess, sometimes there's some nausea and all that kind of stuff that's associated with it. But that's an important distinction, is you can perform these operations under local with IV sedation, but not if you're taking 5 to 8 hours to perform them. With our procedures, they're a little shorter, therefore the recovery is a little bit less intense and easier, and the lack of general anesthesia makes all around picture safer and easier. So if you have the opportunity to do it with IV and local anesthesia, I would choose it to go that way. Some surgeons just don't offer it. So that's a point that you're gonna have to decide for yourself. How do you find a good plastic surgeon? This is a tough question, because being a good plastic surgeon doesn't mean you're a good facelift surgeon. Being a board certified plastic or facial plastic surgeon doesn't mean you're a good facelift surgeon. Facelifts, like everything else, it's its own sort of niche, it's its own thing. You don't go to your general dentist every time if you want a root canal or if you want to get periodontal type procedures, etc., right? You don't go to an orthopedic surgeon if you want to have spine surgery. You go to a specialist who does spine surgery, right? It's that concept that you got to recognize. Again, like I said, like I've chosen to be a facial rejuvenation surgeon. All I do is facelifts, in this case vertical restores, but I do them day in and day out. I don't do noses, I don't do breasts, I don't do anything else. This is literally all that I do. So as a result, if I do it well, I'm gonna get better and better at it over time, and my results are gonna be even better, right? So I think it's extremely important as a consumer to recognize that you need to find somebody who specializes in the procedure that you're interested in. So find somebody who loves doing facelifts, does a lot of them. And when I say a lot of them, it's hard for me to say, because I do, right now I do 6. Up until last year I was doing 8. I just cut down a little bit of my surgical load. So I do six a week is a lot. That's a tremendous number. Probably more than anyone you'll find. So it's not that you have to find somebody who does this many, but you want somebody who's doing it frequently enough, like once a week, twice a week, sort of in that general mix is probably a good frequency to have. Because the reality is, even as I look at my own results and my own evolution as a surgeon, I've gotten a lot better, even compared to 2-3 years ago. I mean, because there's been hundreds of cases that I've done since then. That repetition is really important. But how do you know? So you got to ask that question. You got to ask how often you're doing this. Go by the person's reputation. Like, you have friends, you have family, you have people, somebody knows somebody who's had a facelift done. Look at their results. Try to get a sense of do they fit your aesthetic? Are you happy with the way that person looks? And then compare that to, hopefully, lots and lots and lots of before and afters. Like, it's not enough to look at 1 or 2 before and afters. It's not enough to look at 10 before and afters. You literally want to look at as many as you can possibly can. I mean, 20, 30, 40, 50, because that'll show you some consistency of the outcomes. Consistency of outcome is really, really important, because what you don't want is somebody who hits a home run here and then a single here and a double there, and one looks tight and one looks stretched and one looks totally natural and one looks a little weird and one looks like a different person. Like, you want to see consistency, reliability, because you don't want to play, Russian roulette and end up being the one that looks a little off than, versus whatever. So that's important. You got to evaluate that. Then, of course, you got to look at, the safety of their operating room settings, where they're doing their surgeries, what their level of experience is. Or again, remember, time improves surgeons. It just does, especially if you're doing the same thing over and over again. So if you're doing it with somebody who's fresh out of residency, obviously, I was fresh out of residency and fellowship at one point. I did a nice job. I mean, it definitely wasn't bad. They look lovely, but they look better now. They just simply do. But that's just the way it is. So spend some time researching, spend some time, interacting, meet a few surgeons, meet more than a few if you still haven't felt it in your heart and gut that this is the right person for you. And frankly, do not be afraid to get on a plane or get in a car and travel for somebody. It's worth it. It's your face. Trust me when I say this. It's like, as a surgeon who does a lot of revisionary work on patients who've had other surgeries done, you want to get it right the first time as much as possible. So, if that means you have to save up for a specific doctor, or you have to travel for a different doctor, whatever it is, do your homework. And it doesn't mean always, by the way, that you have to look for the most expensive surgeon. It's not always like that. You'll know once you've looked at all that criteria and you feel like this is the person, right? I mean, at the end of the day. But certainly don't do it the opposite situation, is look for the cheapest surgeon you could find, because it's rare that you're going to find an elite facelift surgeon who doesn't charge, in the upper portion of the charging spectrum, just the way it is, because the demand is higher, the experience is higher, the reliability is higher, and as a result, they charge more. It's just the landscape. So that's something to consider, but it also doesn't mean that there's not a lot of talented, dedicated, and caring surgeons who may be earlier in their careers and practices, and they do a beautiful job. So take the time and look at those criteria and choose for yourself. But before and afters are key, lots of them. So let's talk about risks real quick. So any procedure has risks. Zero chance you can have any procedure and you don't have risks. What are the most common type of risks that can happen after a facelift? Well, hematoma, which is bleeding under the skin, that's the most common. Reversible, you just either have to go back in and stop the bleeding. It's not going to be life-threatening bleeding, but the condition is very, very important you urgently address, because if you don't show up to your doctor, or your doctor doesn't address it, or whatever it is, and this thing keeps expanding, it could affect the survival of the skin in that area, as the pressure from the expanding hematoma causes the blood flow to the skin to become compromised, and as a result, the skin can have issues. And plus, it'll be painful. You wouldn't want to sit around with this anyway. So that becomes more or less like a post-facelift emergency. That's probably in the range of about 1 or 2% chance. Much higher for men, probably double the risk of that for guys, because we have a lot of facial hair, which means more blood supply, all that kind of stuff. So typically speaking, that's the big one. Risk of infection, true for all surgeries. Numbness is not really a complication. You're gonna feel some numbness over your skin. Nerve damage is always a big one that people are worried about. If the surgeon is experienced and knows what they're doing, it's very unlikely they're gonna clip a nerve or cut a nerve. It's more common that a nerve after surgery might be sort of weakened either by stretching, pulling, or putting some cautery, or which is like heat to stop the bleeding around a nerve, and as a result that nerve kind of weakens and you have like a abnormal smile or abnormal blink, or you can't raise your forehead quite right and all this kind of stuff. But that, with a little bit of time, all settles down. It could be a few weeks, it could be a few months, that settles down. But it can happen to the best surgeons. I've had it in my practice, and just with a little bit of time it goes away. We've never had a permanent nerve injury. Those are the big ones. Now, as long as you're not doing anesthesia, the anesthetic-related complications don't exist. But if you do anesthesia, then of course there's anesthetic-related complications, and those you have to just take with the same sort of approach that you take with any other type of general anesthesia that you take. But generally speaking, reward is very, very high if it's properly done, and risk is very, very low. I think in our practice, all of those risks combined is probably less than 1%, frankly. And but you get this awesome outcome. So it's like risk-benefit, very, very favorable. Are there any alternatives to a facelift? Remember, we said facelifts are surgical procedures. There are no alternatives to facelifts. So if you're thinking about threads, if you're thinking about radio frequency devices, if you're thinking about fillers, if you're thinking about, I don't know, what else is there? I mean, people have come up with a million different kind of like ideas of doing something without having to do surgery. None of them will lift your jowls, none of them will lift your neck, none of them will give you a real result that will even be remotely lasting and remotely powerful. Forget all that. Save your time, save your money, save the risks associated with those procedures, and just get the properly done facelift. Search out for the right surgeon, get it done. You'll be more happy than you will ever imagine. And as a result, you'll stop messing around with all these other smaller procedures that really don't accomplish much. If you're after the age of 50, this is going to be your only answer to affecting facial shape. It's that simple. And I'm not saying that only because I'm a surgeon. Trust me, I've done all of those procedures. My nurses and nurse practitioners have done all of those procedures on everyone. We've just learned that they don't work. That's it. And I share this along with you so that you don't have to learn the hard way. You can learn from our experiences. At any age in your continuum, if you're starting to see laxity and things like that starting to form, facelift is still going to be your only alternative. All right, folks, that was a lot. You're armed and ready to roll. Go out and find yourself a great facial rejuvenation surgeon and use some of this information to empower yourselves to make the right choices. Folks, if you enjoyed this, please subscribe to my channel. Send this along to some friends and family. Let's get the word out. Let's help others make good choices. And if you enjoyed it, hit like. If you have any questions, drop them in the comments and I'll do my very, very best to answer as many of them as I possibly can. And if you want more content like this, subscribe to our Karam MD Journal. It's a newsletter that comes to your inbox and you will be in love with the content that's there. I write that every week for you guys. All right, folks, thank you so much. That was a long one. I gotta go catch my breath to get a drink. Until next time, Dr. Karam.